Hello everyone, in this video we'll be covering COQP22, that is Hospital Management Intersection, and we'll cover the basic concept. It's a quick reason, guys. If you're looking into depth or concept, you need to watch out other videos. So this is like quick revision notes. We'll just go through the syllabus quickly, the basic concepts only. So we'll cover this first chapter in this video. If you wanna see further, you can comment down. We'll share it and you can follow the concepts. So if you're watching this video in 26 or 27, you can match the syllabus and showing you in a while, and you can proceed with it. If you think like, you can go through it. So see, this video is there. Sorry, this PDF is there. You can just go through the syllabus if it's matching current syllabus of this year that you are going through. You can refer to this video. So those topics will be covering. I hope you get the syllabus. Let's start with the uh, theory. So first chapter is our health and diseases concepts. So various dimension and determinants of health is there. We'll discuss first of all dimensions of health. There are some dimensions like physical health, mental health, social health, spiritual health, environmental health, and economical health is there. Physical health is your body's ability to function properly. That is your absence of diseases and proper nutrition you are getting. Mental health consists of your psychological well-being, cognitive functions, and emotional stability. Social health include your ability to maintain relationships and interact with the society. Spiritual health include your personal belief, values, and inner peace. Environmental health include the impact of surroundings on your health. For example, pollution, sanitation. Economic health include financial stability and access to healthcare resources. Next is our determinants of health. So there are several factors influence health. For example, biological factors such as genetic and hereditary characteristics and conditions. Behavioral function like lifestyle choices such as diet you are consuming, exercises, smoking, alcohol consumption, and any other habit. Social and economical factors include education, employment, income, social support that also affect your health. Environmental factors like air quality, clean water, sanitation, and housing obviously affect health. Healthcare services like you have access to services, affordability of services, and the quality of medical care you are getting. Next is your political and cultural factors. It includes government policies, cultural belief and practices. Uh, Everyone have their own belief, how you are believing on religious practices for health related and treatment related factors. So let's move forward with the measures and indicators of health and related issues. So measures of health are like um, health is measured in various factors like mortality rate, morbidity rate, expectancy, DALI, that is your disability adjusted life years. So you need to make sure these few uh, abbreviations, right? QALI, quality adjusted life years, CDR, IMR, MMR. Okay, you can remember that. So mortality rate is death rate in the population, right? Crude mortality rate. So crude mortality rate is a death occurring by various causes, right? It is usually measured as death per thousand people and so, right? Infant mortality rate is obviously for infant. Maternal is like for maternal mortality, right? So next is our morbidity rate. So morbidity mortality rate is incidence and prevalence of diseases. Life expectancy. Morbidity rate is basically the rate at which disease is spreading, right, or illness occurring in a population. Life expectancy is just average lifespan of a population. Disability adjusted life years, the burden of disease including premature death and disabilities. Quality adjusted life years, the quality of life adjusted for illness and disabilities. Next is our indicators of health. So nutritional status indicators, indicators like the factors which shows like you are healthy or not. Right. So nutritional status indicators, environmental indicators, healthcare utilization indicators, social economical indicators. So a body mass index tells the status of your nutritional health, malnutrition or not nutrition like underweight, overweight, and so and so. Environmental indicators tells your environmental health is okay or not, like you are living in air quality, good air quality, sanitation coverage also we check. So based on that we consider that you are good in healthy environment or healthcare utilization indicators like immunization coverage, hospital and bed ratio in your area, social and economic indicators like literacy rate, per capita income, all those are also considered in terms of health indicators. So if some people is not having that much literacy about other health awareness and their income is very low, you may find like those people are suffering from some diseases that they're carrying forward throughout their life. So this is again a indicator of bad health. Natural history of disease and sciences. So a stage of disease progression, we have two categories in that. That is first is pre-pathogenesis stage, and another one is pathogenesis stage. So pre-pathogenesis genesis stage. So pathogenesis is what? Pathogenesis is development of a disease, right? So pre-pathogenesis before the disease. Right. So before the disease, someone is healthy. Before the disease, what we can, do or we have in there. So interaction between host, agent, and environment. Host is what? Host is the guy who is having who is about to having the disease. Agent is what? Who is causing the disease. Agent is also called pathogen, right? Pathogen. Environment is obviously the environment you are living in, host is living in. Preventive measures can be done like vaccination, hygiene can be maintained. Pathogenesis stays. So this is the stage after the disease already occurred to the patient. Those include subclinical stays, clinical stays, outcome stays. So there's a few terminology I'll tell you. For example, agent, host, environment that we'll discuss. Before that, like pathogenesis. Pathogenesis is obviously development of disease, I told you. Pathogen, we have host, right? Sorry, agent that cause the disease, such as virus, bacteria, and fungus. Pathogenicity is one term that means ability of a pathogen to cause the disease, right? Okay. So next we have subclinical stage. This include disease present but no symptom. Incubation period of infection. For example, you may know when like typhoid is there. So there is 15 days of incubation period for typhoid. So it can be up and down, but in on an average, it is nearly 15 days, 14 days like that. So these are incubation period. Then clinical stage when symptoms start to appear, right, and leading to diagnosis and treatment. Outcome stage is like when person is getting a recovery and disability or death, right? That is outcome. Outcome is like any final conclusion after anything. So that is like after disease occur, either person will survive or disability will occur or the death will occur. Then we have epidemiological threat. So it basically tells how host, environment, and agent interacting each other to start the pathogenesis or to cause a disease, right? So we have host, um, which is age, immunity, and genetic factors. Like these are the factors that host uh, infection pathogenesis depends for the host. For example, age of the host, like it's infant or the child, so may have more possibility of getting the infection, right? So those factors like immunity, their immunity, genetic factors also include that make them severe or less uh, uh, less chances of the infection. Again, agent is there like bacteria, virus, chemical toxins, environment, climate, sanitation, living condition affects, right? So these are epidemiological trials. Next, we have primary healthcare services. Those include your PHC and okay, let's discuss. PHC is the first level of contact between individuals and the healthcare system, providing essential health services. Component of PHC is as per Alma et al. Declaration 1978. PSC components include health education, nutrition and food supply, safe water and sanitation, maternal and child care, including family planning, immunization, prevention and control of epidemic, endemic diseases, treatment of common disease and injuries, essential drug supply. So those are the components of primary health care centers. Then we have level of healthcare. So that is primary care, secondary care, and tertiary care. Primary care include basic healthcare facilities like clinics, community health centers. Secondary care include specialized care like district hospitals. Uh, Tertiary care include advanced medical care like specialized hospital for eyes, for heart, and so on. Then we have hospital and its role in health and diseases. So functions of a hospital include curation, prevention, education, research, and rehabilitation. Curative function like include diagnosis and treatment of diseases. Preventive function include immunization and screening health problems. Educational function includes training for medical students and professionals. Research function include development of new treatments and medicines, and rehabilitation function include post-treatment care and therapies. Types of hospital include general hospitals, specialized hospital, teaching hospitals, private and public hospitals. So general hospital usually provide a wide range of medical services, and specialized hospital as we discussed like cancer and heart hospital like that. Teaching hospital mainly institute based like medical college for training students. Private and public hospital based on funding and ownership. There are types of hospital administration and management. So it include hospital human resource management system, staffing, training, and professional development. It all cares about. Then we have financial management that cares about budgeting, insurance, and billing system of the hospital. We have infrastructure and equipment management that cares for ensuring availability of necessary medical facilities. We have patient care services, which mainly care for emergency care, inpatient and outpatient care. So that we concluded about our first chapter. If you wanna proceed forward, you can watch the following videos after that. Thank you for watching. Have a good day.